Hi friends, once again welcome back to my channel Mookambika Nursing. Friends, here we are discussing questions for RRB Nursing Officer exam preparation. Also these questions will helpful for your other nursing officer exam like Jimber exam is coming and NBS is also waiting, then DME is also we are waiting. So you can prepare from this. Today we are discussing one set of previous year question. This is one of the staff nurse grade 2 exam question and answers. We can see the question one by one. First question, best method to collect urine for culture in children under 2 years is? Options: option A, midstream voiding, option B, catheter aspiration, option C, bag aspiration, option D, suprapubic aspiration. Here our question, which is the best method to collect urine for culture in children under 2 years, that is below 2 years? Which method is using to collect urine for culture sampling? It is correct answer is suprapubic aspiration. Option D is the correct answer. Suprapubic aspiration means it's an sterile procedure that involves inserting a needle into the bladder in the suprapubic region to obtain the urine sample. So obtaining a sterile urine sample, especially this is doing in children and also we can do in adult, but children under 2 years age using suprapubic aspiration to take a culture sample. Move on to the next question. Instrument used for measuring urinary specific gravity is all except. Options: option A, urinometer, option B, reagent strips, option C, a refractometer, option D, densitometry. Our question, among the following, which one instrument is not using for measuring urinary specific gravity? And the correct answer is, it is densitometry. Option D is the correct answer. Densitometry means it is the quantitative measurement of optical density in light sensitive materials. It is not used for measuring the specific gravity of urine. All others are used to measure the specific gravity of urine. And the next question, which one of the following is the correct sequence of communication process? Options: option A, sender, message, channel, feedback and receiver. Option B, receiver, message, channel, feedback and sender. Option C, message, sender, channel, receiver, feedback. And option D, sender, message, channel, receiver and feedback. Correct sequence of communication process among the following, which is the correct sequence? And the correct answer is option D, sender, message, channel, receiver and feedback. Move on to the next question. Gather approach is useful for? Options: option A, chlorination of water, option B, counseling, option C, refuse disposal, option D, data analysis. Gather approach is mainly used for counseling. Option B is the correct answer. Move on to the next question. The tool used to assess the family's copying is? Options: option A, copying index, option B, copying deficit, option C, nutritional assessment, option D, anthropometric measurement. The tool which is used to assess family's copying is option A, copying index. Option A is the correct answer. And the next question, which one of the following concept recognizes the strength of social, economic, political and environmental influence on health? Options: option A, biomedical concept, option B, ecological concept, option C, holistic concept, option D, psychosocial concept. The concept of health which recognizes the strength of social, economic, political and environmental influence is related to holistic concept. Option C is the correct answer. The next question, the essential members of the health team is? Options: option A, an auxiliary worker, option B, health inspector, option C, medical officer, option D, public health nurse. All are important in a health team, but the essential, we can't avoid this person from the health team, that is auxiliary worker. Option A is the correct answer. And the next question, temperature in an ILR. ILR means ice land refrigerator at PHC is recorded using? Options: option A Carter thermometer, option B dial thermometer, option C sling psychometer, option D anemometer. Temperature in Iceland refrigerator at pH is recorded by using dial thermometer. Option B is the correct answer. Move on to the next question. Action which halts the progress of a disease at its incipient stage and prevents complication is defined as. Options: option A primordial prevention, option B primary prevention, option C secondary prevention, option D tertiary prevention. Here the question is, the measures which taken to prevent the progress of disease in its initial stage and prevent its complication is coming under secondary prevention. Okay, so option C is the correct answer. First option, primordial prevention. Primordial prevention means action taken prior to the development of risk factor. Primary prevention means action taken prior to onset of disease, before coming the disease, that is primary prevention. Here secondary prevention means action taken to interrupt the disease progress. Okay, so the progress of the disease is interrupting and to prevent the complication, that is secondary prevention. And tertiary prevention means the action mainly taken in the later phase after onset of disease is tertiary prevention. For example, disability, limitations, rehabilitations, all coming under tertiary prevention. And the next question, WHO formation days. Options: option A April, option B May, option C June, option D July. World Health Organization Day is observed in April 7. So here the correct answer is option A April. Move on to the next question. Number of ASHA visits after home delivery is. Options: option A 4, option B 5, option C 6, option D 7. So after home delivery, how many visits will make a ASHA worker at home? Okay, so and the correct answer will come option D 7 visits. After home delivery, ASHA worker makes 7 visits to a newborn. Okay, so ASHA worker makes 7 visits to a newborn after a home delivery. And also the sequence of visit we can see, the day of delivery, that is 1 visit within 24 hours of delivery, that is the first day. And thereafter day 3, day 7, day 14, day 21, day 28 and day 42 days. Okay, 6 additional visit of these days, 6 plus first day. So total 7 visit will make an ASHA worker after a home delivery. And the next question, Millennium Development Goals were launched by. Options: option A WHO in 1998, option B UN in 2000, option C WHO in 2000, option D UN in 1998. So Millennium Development Goals were launched by UN in 2000. Option B is the correct answer. Millennium Development Goals were launched by UN in 2000 September. Okay, it is mainly combat or mainly focus on the poverty, hunger, disease prevention, literacy, discrimination against women. All are coming in Millennium Development Goals. And the next question, who among the following is chairman of Central Council of Health? Options: option A Prime Minister, option B Secretary of Health, option C Union Health Minister, option D Director General of Health Service. Chairman of Central Council of Health is Union Health Minister. Option C is the correct answer. And the next question, true about Indian reference woman is. Options: option A age 18 to 29 years, option B weight 60 kg, option C work is mainly sedentary, option D 10 hours of occupation. Question, which is true about Indian reference woman, and it is correct answer is option A age 18 to 29 years. Move on to the next question. The most common cause of blindness in India is. Options: option A glaucoma, option B cataract, option C refractive errors, option D vitamin A deficiency. Which is the most common cause of blindness in India is cataract. Option B is the correct answer. And the next question, National Health Policy is based on. Options: option A primary health care, option B tertiary care, option C child care, option D mother care. National Health Policy is based on primary health care. Option A is the correct answer. And move on to the next question. Which one of the following is not a socio-economic indicator? Options: option A, literacy rate; option B, family size; option C, housing; option D, life expectancy at birth. Among this, which is not a socio-economic indicator? Literacy rate is related to socio-economic indicator. Family size, housing, all are related to socio-economic indicator. But life expectancy at birth is not a socio-economic indicator. Option D is the correct answer. And the next question. The brownish triangular raised foamy patches seen on the white portion of the eye is called. Options: option A, night blindness; option B, xerophthalmia; option C, keratomalacia; option D, bitoid spot. It's a direct question. Brownish triangular raised foamy patches seen on the white portion of the eye is called bitoid spot. Option D is the correct answer. Move on to the next question. Chloramine is a loose component of. Options: option A, chlorine and ammonia; option B, chlorine and sulfur; option C, chlorine and phosphate; option D, chlorine and potassium. Chloramine is a component of chlorine and ammonia. Option A is the correct answer. First 25 questions we covered in this video, and the next questions we can see in the next video.